Look here at me. Look up. Look over here. Look down. Close your eyes real tight. Open them up wide. Show me your teeth. Good. Okay.
And I had the option of saying you can have the treatment or do you want hospice? My answer immediately was hospice.
It can be a scary word because hospice, if someone's going into hospice, typically it's going to be the end of their life.
What I love most about practicing palliative medicine is that there's a real focus on what the patient wants. It's not me as the doctor deciding this is what should be done. It's really, okay, let's talk about what you want. It doesn't mean that you're not working towards a cure. It means that you're also focusing equally on quality of life.
I've been feeling okay the last few days.
The goal here is to make the end of life process as positive as we can, but also one that happens without fear, without regret.
I got a call on my cell phone from Mom's cell phone. She was crying, sobbing. What's the matter? What's the problem? They want to take blood from me again. They did it twice already, and it hurt. And I don't want them to do it anymore.
Pain is scary.
And the pain hurts.
It does. It does. But we can make sure you don't have pain. I can make sure you don't have any shortness of breath.
I had her put the nurse on the phone, and I said to the nurse, whatever it is that she wants, if she wants no more blood tests, that's the way it's going to be.
In the more curative framework that most healthcare operates in, if something's wrong, you fix it. When serious illnesses begin to layer to the point where someone is not going to recover, how much trouble does her memory give her? I really try to look at, is this going to help them live better? Not necessarily just live longer, but live better. If they can live better and live longer, hey, did you get your medicine? Yep. That's good. But that's not always the case.
Her doctor offered a lot of options for treatment for what her problems were, and all of them involved some kind of invasive measure. And she said, I just don't want to be in pain. So that's when they called in the consult for hospice, and they've been fabulous.
Lost in the book, forget time and any place, everything else.
Yep.
So
Hospice and palliative care has allowed people to have a choice. Instead of dying perhaps in a hospital, undergoing aggressive therapy, they're able to have a choice with where they pass on to the next life and how they do it.
I feel I'm back to being able to be a person rather than somebody being cared for.
They're still themselves inside, and part of what I love about working with the elderly is getting to know the people that they really are and not just the illness. Seeing 20 patients a day made me miserable. And when I found palliative medicine, it was like a light bulb went off. Lousy. Any place in particular that you feel lousy? They should get what they want. Too often it gets lost in the shuffle of medicine, what we want. People don't realize they have choices. So a lot of what I do is try to listen to them and lay out choices they may not realize they had.
I know that I have friends that thought that our supporting her in this decision is a bad thing, that we should have encouraged her to have treatment. But we respect her enough to let her make this decision about her life. I hope I'm as strong when it's my time.
My patients don't get better very often, but I make their life better. And that helps me to sleep. Here, use your hand. There you go. There you go.